name's Siobhan Maclean. I'm going to be doing the presentation in the webinar this morning. Zoe, do you want to introduce yourself?
I'm Zoe Yeomans. I'm the Practice Lead Consultant Social Worker for the South of the West Midlands Social Work Teaching Partnership, and we commissioned Siobhan to put these sessions on, so I'll do a brief introduction and then hand over to Siobhan.
Fabulous. Charlotte, do you want to introduce yourself, because this is your first time on this side of the camera at least, isn't it? So
yes, it is. So I'm Charlotte Pattinson. I'd like to say I'm still newly qualified, even though I've been graduated a year ago. So I'm currently completing my ASYE in an adult social care team. So I'm just bringing this, I suppose, students' perspective to the webinar.
fabulous. Thanks, Charlotte. So the first two webinars we had students joining us. So we thought today, because we're talking about assessment, it'd be good to have a newly qualified social worker, because you're going to share with us your experiences as both a student and as a candidate for the ASYE. So you can bring more to that. And then I think I best introduce Omar, because it looks like he's still busy. So Omar Mohammed is a second-year student at the University of Birmingham. He's just found out where he's going on his placement, so he's getting excited by that. Omar works with me doing some webinars. We do some weekly webinars for, oh, you're back, Omar. We do some weekly webinars, and Omar is brilliant at the tech, and Omar helps with those, so he's come along to these to help us out with the tech. Did you want to introduce yourself, Omar, or was that okay? Okay, fabulous, thank you very much. So Zoe, do you want to kick us off then with your slides?
Of course I can. So we are the West Midlands West Midlands Social Work Teaching Partnership. It's always a mouthful. I thought I had got used to it by now, but obviously not. So we're one of 23 accredited social work teaching partnerships, and there's some question as to whether we're potentially one of the largest ones. I'm seconded into the role of Practice Lead Consultant Social Worker, and we're split across the North, South and Central region of the West Midlands. So we include all of your authorities, HEIs, NHS trusts, and we try to link in with all the senior practitioners, principal social workers and managers, just to get a really good overview of social work. Next slide please, Siobhan. So that's just our kind of our vision essentially, is to build on the collective strengths of the partners to make sure that we are delivering good quality student placements, student experiences, NQSWs and CPD offers for our practitioners as well, post qualifying, post NQSW, just to keep that CPD going on and continuing for everybody. So next slide please, Siobhan. Oh, sorry. We obviously acknowledged very early on that there was a gap with COVID and the lockdown, and obviously going into another one. We need to be really mindful of how we're supporting students, and for the purposes of this webinar, newly qualified social workers through placements and ASYE years. We've had two webinars that were wonderful. The first one is on our YouTube channel. The second one is downloading now. So I'm keeping an eye on that. That's uploading to the YouTube channel. And this one will be added on there for people to watch back as well. So that's kind of our offer there. Next slide, Siobhan. So these are all the different places you can find us, where we're a little bit everywhere. Twitter, Facebook, Instagram, YouTube, LinkedIn. And there is the website where there's future training coming up with Train to Teach at Staffordshire University. We've got some sessions with Prospera Tedham on culturally sensitive social work, so feel free to have a look on there and see if there's anything else that can support you in your practice moving forwards, because at the end of the day, that's kind of what this is all about. It's making sure that you have access to as many resources as possible, and you can let us know if there's anything that we're missing or we need to cover. Feel free to drop me an email, just so that we can look into it and see what we can offer. So that's just a little bit about us. So I'll hand over to the main event. So Siobhan has been commissioned to put on these webinars. So I'll stop talking and we can just listen to Siobhan. Okay, thanks Siobhan.
Thanks, Zoe. So if I just ask everybody else to switch their microphones off then whilst I'm doing the presentation. When Charlotte's back later, she'll put her microphone back on again when Charlotte brings her perspective to the presentation. But if we have no other microphones on, then hopefully the sound should be okay. Zoe, if you feel you need to, if there's something in the chat you want to pass on, just switch your microphone on and just shout. That's absolutely fine. So today we're going to be looking at practice assessment in contemporary practice. So whether that's in a virtual world or whether that's in a remote world, we've talked about these different terms in the other webinars. But we know that we're going to go into effectively another lockdown this week. So this is going to continue for some time. So let's maybe refer to it now as more contemporary practice. And what we're going to do today is look at some of the challenges that we might face in assessment specifically. We looked in the first session at the learning environment. So we looked at all the environmental issues. In our second session, we looked at supervision. And today is going to be specifically about the assessment issues. If anybody's old enough to remember Sesame Street, Omar never gets it when I do this, but Sesame Street always used to begin with, today's programme is brought to you by the number such and such and the letter such and such. So this morning's webinar is brought to you by the magic number 3 and by the letter F. And the letter F may become clear as we go through the session, but you might want to think about what the letter F might mean in practice assessment. Last time we did all the P's of supervision. Today we're doing some of the F's, but we're predominantly going to focus on 3 as the magic number because there are 3 webinars and this is the third of the 3. We're going to look at 3 forms of assessment and 3 stages of assessment. We're also going to look at effectively 3 standards in practice education assessment, 3 sources of evidence and the 3s of feedback. So there's a lot for us to get through. I'm going to whiz through some things and I'm going to spend more time on others, but you can have these slides as we did last time. I think we'll work out by the end how we're doing that, but we did let you all know last time how to get hold of the slides and we'll do the same again for today. So we're going to use those 3s, but there's one other 3 that we're going to be looking at effectively. We're going to look at the past, the present and the future, because how things are now is quite different to perhaps how they've been in the even very recent past, and it might change the way things look for the future. So we're going to be looking at all 3 of those things. I must say that as a practice educator for 27 years, some of the challenges that I've faced in working with students very recently, so through the lockdown and through pandemic practice, I found myself returning to some things from the past to help me to keep things stable, if you like. It's been something I've needed to think, well, what framework can I use for this? And I've gone back to some things that are actually quite old, and I'm going to share with you today some things that are actually quite old, but I found them really helpful in the present moment. So I'm going to start off with something that is a really old move, but actually is something that's very important for us to still think about. Is we used to talk in practice education about competence-based assessment, but now we're about capabilities, and we're really moving away from that competence-based understanding towards capabilities. We're focusing not so much on what is done and how it's done it, but why it's done it. And this goes back to, because I was very working with students on what was called a virtual placement this summer, they could have completed their placement effectively without ever leaving their house. I mean, they didn't, and it wasn't how it ended up, but that was the arrangement, was they could have done that sitting in their bedroom and done all of their placements sat in the bedroom. So I was kind of, well, how do I assess them? How do I work out whether or not they can go on to the next part of their course? And so I did go back to really revisiting that last shift we had from looking at competence-based to capabilities assessment to remind us that assessment should never be a tick box experience. In the early days of me being a practice educator, I think things did become quite tick box led for us. Those of you who've been around a while might remember the old National Occupational Standards, and there was particular units that had to be met and ticked off. And when we moved to the professional capabilities framework, we were encouraged to move away from that. I do still think some practice educators work in quite a tick box way in assessment, but we really need to move away from that. And a movement away from that tick box has been particularly helpful in virtual working. The other thing that I've found really helpful to revisit is Leicester's work, and I've drawn on this a lot, and I know people are drawing on it now at the moment. It's being referenced quite a lot at the moment, certainly my work around this. And Leicester suggested in the late 1990s, when we were changing everything over into 2000, he wasn't a social worker, he was talking about academia, but he suggested that students that were assessed, he was talking about professional assessment. And it was really at the point that nursing was changing into Project 2000. And he suggested that a competence-based approach to assessment just considered whether a student was able to follow a map. So a competence-based approach was like saying to a student, here's the map, I'll meet you at the destination. If you manage to read the map and get there, you've passed. Whereas actually he said what we should be doing in professional assessment, we should be looking much more towards a capabilities approach, where we introduce the idea that the student or the newly qualified worker becomes the map maker. What we should be doing with a student is be clear with them, where are you now? Where do you need to be, and how are you going to get there? Because everybody has a different starting point. Everybody will face different barriers along the way. So to make sure the assessment is unique, we should see the student or the newly qualified worker as their own map maker. And effectively, we are working much more towards that now. You know, the student develops their own learning agreement in conjunction, you know, but they write it up. In partnership with the practice educator, they should develop the plan for the placement. So effectively, that's the map, because that's looking at where am I now? How are things going to work? Where do I need to be? The newly qualified social worker will complete significant mapping by identifying at the start of their ASYE year, here's where I am in relation to the standards, and looking at here's where I need to be, and then they will meet with their assessor at various points to review their journey. So it is very much, it's helpful, I think, to see the learner as the map maker. And the other thing that I've revisited during lockdown, and you might think, well, this is all very old, but, you know, we're looking at the past, we're going to get to the present. So I revisited the principles of holistic assessment from the College of Social Work. So 2012, the College of Social Work wrote the paper, Principles of Holistic Assessment, which is still held, it's on the BASWA website, so it's very easy to access. It's still held as the Holistic Assessment Principles. And these 6 principles are take us into what is holistic assessment. So assessment is progressive over a period of time, so either initial qualifying placement through to ASYE, whatever, and that should lead to an effective summative assessment. Assessment must be consistent with the appropriate PCF level descriptor and should include sufficiency and depth of evidence across all 9 domains. Individual capability statements are important in terms of providing detail of expectations for each domain, and they're particularly significant to identify gaps, areas of development, or concerns. And that's very much the way I use individual capability statements, is not as a tick box, but is as looking at this person is struggling here, and I'll then drill down into the capabilities, the specific capabilities, to see what I can do to support in that area. The assessment process and the judgment must be trustworthy, it must be reliable, and it must be transparent. So there must be clear audit trails, for example. Evidence must include the ability to reflect critically, and that should include reference to different sources of evidence, different knowledge and research. And the learner will contribute evidence for assessment, but the professional decision about sufficiency must be made by a registered social worker. For students must meet the practice educator professional standards. So they're the principles that we're working on. That's a bit of the past, a bit of the background, but I've still found it helpful. And I do think sometimes what we know, don't we, about crisis and trauma is that people like to go back to their history when they're experiencing crisis and trauma, because that can help to feel safe. And actually going back to something that has worked for you in the past is what we tend to do during crisis. So going back to what's worked when there's been significant change in assessment previously, going back to that can be helpful to look at what keeps us stable in this situation now. So since all of that, since the past, I suppose, I think the biggest change for me as a practice educator, and I've already heard from the chat that there's people here who've been practice educators for 20 years at least, and there might be people who've been longer. The thing that's changed the most during my 27 years as a practice educator is the standards that we assess against. And currently there are 3 sets of standards, and this is the first time, I think, in all of the time that I've been a practice educator that we've had so many standards flying around. Not necessarily that we're using all at the same time, but we've had so many different standards flying around. So the 3 sets of standards, just so I can clarify this, is we've got the Professional Capabilities Framework, and that is profession owned, but it's held for us at the moment by ASYE, but that's the overarching framework for social work education and professional development in England. The KSS, these are all England standards, they don't apply across the whole of the United Kingdom. The KSS, the quotation there is taken from the chief social workers for adults and children working together, and that was a statement that clarified the KSS, so the knowledge and skills statements, set out what a social worker should know and be able to do in specific practice settings, in specific roles, and at different levels of accountability. So we've got the PCF and we've got the KSS, and then we've got Social Work England professional standards, and taken from the website, Social Work England say our professional standards set out what a social worker in England must know, understand and be able to do. Now, I think if you actually were to look at these, a new practice educator could get quite confused by this. I don't know if people feel clear about this, but I wanted to start with some clarity for people who are new to practice education, and feel free to put in the chat what your thoughts are about this. But for me, I think as a new practice educator, it must feel quite confusing, the fact that we've got all these different standards. And then if you want to add to it, you've also got the practice educator professional standards that you're meeting. So I've not even gone down there. I've just looked at these are the 3 standards really that are going to relate into practice assessment. And I want to demonstrate my understanding of this through a theory. And the theory is the theory of horizontal and vertical development. Now, this is a theory of development. It's not a social work theory, it's a theory of development. But Lord Laming referred to this in his report into the death of Victoria Climbit, and he talked about the need for this in social work. So that was when it started to first be talked about in social work. But what we've got is we've got 2 aspects of development, I suppose. We can develop both horizontally and vertically, and there's different ways of understanding that, but the way that I would look at that, and the way that it's kind of it works well in social work to use it like this, is to think about our vertical development as our generic development as a social worker. So this is about the knowledge and skills that all social workers, wherever they work, whether they're in children's or adults or the independent sector or the statutory sector, we should all share certain knowledge and skills wherever we are. That's your vertical development, and that is what is represented in the Professional Capabilities Framework, which is a generic framework. This capability, the domains can be met in any area of practice because it's a generic standards. So that's our standards as a social worker. That's, if you like, that's our professional standards as a generic practitioner. But then we have our horizontal development. Now, horizontal development is when we then become, we work in a specialism in a particular area. So a children and families social worker, or an adult social worker, or a social worker who works in the independent sector, who perhaps works across both adults and children's, which can become then confusing in terms of standards, but our specialist area. When I first trained as a social worker, we were generic. We became specialists quite soon afterwards as a result of the NHS Community Care Act and the Children Act. At the same kind of time in the early 90s, we started to move towards specialisms. So in terms of our specialist area of practice, that's our horizontal development. That's what's represented in the knowledge and skills statements. So there's a knowledge and skills statement for children's practitioners, and there's one for adults practitioners. And there are also knowledge and skills statements for supervisors, one for children's, one for adults. Increasingly, you will see these referred to on government websites, on, well, the government website, but on the Department for Health and Social Care and on Department for Education. They refer to the KSS as the PQS. And that becomes confusing because people say, oh, there's another set of standards that's come out, but the PQS and the KSS are identical. It's just that largely now the Department for Education, Department for Health and Social Care are referring to the KSS as PQS, which I think is sensible because it demonstrates, it stands for post-qualifying standards. And so I think it makes clearer that the KSS are about post-qualifying. What we should have is the PCF are our qualifying standards. So as a practice educator, our focus is on the PCF domains, the 9 domains. That's where we should be assessing social work students. At the point of qualifying, then of course, the regulatory standards also come into play, because whenever you become regulated, so at the point of qualification, the regulatory standards then apply to you. But then the specialist area, that should be after qualifying. And the fact that the government is now referring to them as PQS, I think is very helpful because it demonstrates their post-qualifying standards. However, you will find some universities ask you to look at the KSS during qualifying training. You'll find that they won't ask you to assess against it, but they might ask you to make reference to the knowledge and skills statements in your report, but you are assessing against the PCF. If you're assessing a student social worker, you're assessing against the PCF. If you are assessing a newly qualified social worker for ASYE, you're assessing against the KSS. So for me, this is an important way of understanding the different frameworks. Why do we have them? I find lots of people will say, oh, just cross-reference them, almost as a kind of, we've ended up with different standards by mistake, and if you just cross-reference them, it's okay, just merge them into one. Actually, I think that's really problematic. Don't try merging them into one. We have 2 sets of standards for clear reasons. We have our vertical development, our generic development as a social worker, and then we have our development in a particular social work role, and we need different standards within those. So cross-reference, just saying, oh, cross-reference them as though, well, it's just a mistake, we've ended up with different standards, I don't think it's helpful. I think it's important to understand and clarify why we have the different standards. So that's my view of horizontal and vertical development and why we have all of these different standards in social work that's new, I think, in many ways during my practice educator career. So there's your 3 sets of standards. Now, what about 3 forms of assessment? And these will apply to whether you're working with a student or whether you're working with a newly qualified social worker. So we have benchmark assessment. Now that's our assessment that we do right at the start of working with somebody, almost to know where are they starting from, because everybody starts from a different place. So if you're working with a final placement student, for example, you should read their first practice educator report, because that will give you a benchmark as to where do I expect them to start. A student might come with a preparation for practice portfolio, read that, that's the benchmark assessment. For Charlotte, who'll talk later, Charlotte's probably done a benchmark assessment at the beginning against the KSS of here's my level of confidence and my level of capability in relation to the knowledge and skills statements, so that her assessor can work with her where she starts, because everybody starts in a different place. So that's your benchmark assessment. Then we have both formative and summative assessment. And formative assessment is the ongoing assessment that we do. It's the things that we do along the way. So a direct observation would be an example of a formative assessment. So would gathering feedback. So would be reviewing the documentation that a practitioner keeps. They're all examples of formative assessment. They're ongoing assessment that help us to form a picture. And then summative assessment, if you hear reference to summative assessment, that's the assessment that we do at the end of a process, and that kind of summarizes everything. But it can be that if you take it outside of practice assessment and think about, if any of you have got kids at school or whatever, then formative assessment is like coursework that you do along the way, and summative assessment is like an exam, it's like your end point. An over focus on end point assessment is considered as really poor in terms of it only takes a snapshot of where somebody's at. It only looks at that one day, that one time, rather than looking at over a period of time. Some of you might be working with social work apprentices, and social work apprentices have a much more significant summative assessment, because modern apprenticeships have to have an endpoint summative assessment. So we need to understand the difference between formative and summative, but as a practice educator, we will be doing benchmark assessments at the beginning, formative assessments throughout the placement, and a summative assessment at the end. However, it's important to say, if you look at the little diagram there, I don't know if I've done it clearly enough to show that there'll be lots of different assessment activities during a placement. So we might do an observation, we might gather feedback, we might look at a reflective account, we might look at an assessment that a student's written, or a report that they've written. All of those things are formative assessments. You might think that then the summative assessment comes at the end of that, but actually it doesn't. The summative assessment, in a way, eats up all of that formative assessment. It's not something that's done separately. The summative assessment is basically looking at the whole in the light of the parts, and the parts are the formative assessments, and it all comes together in your summative assessment. So the student, the newly qualified worker, whoever is being assessed, nothing should come as a surprise to them, because they know all the way through how things are going. And if you remember back to this slide, which is similar to a slide that we used in webinar 1, when we were looking at how do we encourage students to take a deeper approach to their learning, especially at the moment when we're working remotely, how can we really encourage a deeper approach? Well, all of the research, all of the literature suggests to us that the use of regular formative assessments encourages a deeper approach. A focus on an endpoint assessment just encourages a surface approach. If I think back to, I did French O-level, it was O-levels in them days. I cannot say anything in French now. I just had a test, I revised for the test, I passed the test, I now can't say anything except, hello, my name's Siobhan and I'm 16. That's all I can say in French. That's the whole part of, because it was all about a surface approach. It was all about just do it to meet the requirements. And that's what we have to avoid with students. Is this shouldn't be about do something to meet the requirements. This should be about learning to be a professional. So they're the different forms of assessment. We're running through it because I want to spend most time looking at direct observation, because that's what most people have asked to look at. So the 3 stages of assessment, because all three stages of each assessment is we plan it, we gather the information, we report the results. It's in many ways, rather than it being an assessment process, what we're doing is much more akin to a research process. In many ways, it's what we're doing. We're researching the quality of a worker's practice. So we should plan. We should gather the information and we should report the results of that. That's what we do. That's how we do an assessment. And in many ways, the 3 stages of assessment reflect the 3 stages of reflection that we covered in webinar 1. So as a quick reminder, we should have 3 stages of reflection. We reflect before we do something. That's reflection for action. We reflect during it, in action, and then afterwards on action. That's the reflective cycle of plan something, do something, review something. It's exactly the same cycle for assessment. Plan the assessment, do it, and then look back and review it. And in planning, there's 2 parts to think of, really. You've got a general overall assessment plan when you're working with a student, which is really what's in the learning agreement. So learning agreements all contain an assessment plan, which kind of says this is the number of direct observations. This is what we expect in terms of feedback. This is what needs to go into the portfolio. In a way, that's the overall assessment plan. But then each assessment activity needs to be planned. That might be informal. It doesn't mean you've got a written plan. But you need to plan your direct observations. You need to plan how you're going to gather feedback. So the planning stage is important. And I suppose I wanted to talk about the 3 stages of assessment, just to say, don't forget you need to plan. So you need to plan. It's that whole reflective cycle again. But the main thing we're going to look at today in terms of the 3s is that there are 3 sources of assessment. This isn't just about social work. This is about any professional assessment. There are 3 sources of assessment, and that comes through triangulation. What we have is we have observation evidence, we have feedback evidence, and we have product evidence. And throughout your social work career, you will be familiar with that. Those of you who are doing your practice educator professional standard qualifications now, you will be being observed by a qualified and experienced practice educator. There will be feedback coming from the student. You will need to show the product of your work to your assessor. So your assessor will want to read the final report that you wrote about the student, and maybe some direct observation reports, and maybe some supervision notes, and the product of you being a practice educator. So this goes through our entire career. Any professional portfolio will always be triangulated. You will always need, as an assessor, to look for observation evidence, feedback evidence, and product evidence. And in many ways, that reflects what we do when we're doing assessments in social work. We gather observations, feedbacks, and products we look at when we're assessing families or we're assessing adults in social work. So it's very reflective of that. But the main thing we're going to spend time on today, the thing that we've been asked to do mostly in the session, is we're going to look at those 3 sources of evidence in a remote world. How does it work in a remote world, gathering those 3 sources of evidence? And the one we're going to focus the most on is direct observation. And Omar has a poll here that he is going to put up. It depends what machine you're watching this on, whether you're using your phone or whether you've got a laptop or whatever, whether or not you can see the poll. But in front of you, if you can see it, there should be a poll that's come up that is talking about the methods of observation that we're using. And I put on there this year. So if you think about this year, I have undertaken observations of practice through, and then you can list as many of these as you want to. So have we done direct observations on the telephone? Have we used WhatsApp for direct observations of practice? Have we used Microsoft Teams to directly observe the practice of others? Have we done in-person observations? Have we used video calling? Oh, there's a typo on there, but I think everybody can see it says video calling. Have we used Zoom? Or have you used something else? So other, don't know what other might be, but is there something else that you've used? And if there's an other, maybe in the chat, you could say what the other is. But this is all about looking at how have we done observations of practice. And so far, we've got just under half of the audience have completed the poll. So I'm going to wait a little while longer to try and get a few more votes in. What we're trying to do here is look at how are we actually doing observations at the moment. I'm aware a couple of you may not be able to see the poll. It does depend what device you've joined on, but most people generally can see the poll. And if you can't see the poll, then feel free to just type in the chat.
We've got a few, Siobhan, coming in. We've got someone saying another might be a walk and talk observation. Some people talking about other platforms that they're using, Cisco, WebEx. Some people haven't undertaken observations yet, so I think getting some ideas here, so feel free to share. Yeah, so Skype's being put on, so yeah, there's some other platforms basically. I think they're just being brought up that yeah, we're aware there's a lot more out there, and different organisations can or can't use certain ones. So yeah, that's great. Some face-to-face ones coming through. Use of WhatsApp's definitely coming through in the chat as well. No, that's great. Lovely to hear from you all. Keep going.
So what we've got on the poll, there's still 1 or 2 votes coming in, but I'll tell you there's 107 people voted now, and what we've got is 41% of people have done an observation on telephone. 42%, that's just gone up to 18% have used WhatsApp, 69% have used Microsoft Teams, 62% have done observations in person, 18% video calling, 14% Zoom, and 10% other. So we've got a real mix there. Now, had we done this 12 months ago, this wouldn't have even been an option. 12 months ago, it would have been that observations are face-to-face. And I can remember there was a time where there was a project about the use of videos to do direct observations, and there was such an outcry from practice educators saying they were really worried about doing this, it couldn't happen, they really wanted to just continue doing observations face-to-face in person. I mean, it was a huge outcry. And then of course overnight we've had to move into changing things up a lot because of the pandemic. So but I mean, if you look at it there, the biggest 69% of people, so the biggest has been the use of Microsoft Teams to do direct observations. So we've got a whole range of options now for undertaking direct observations. I mean, I've worked with 5 students this year, and I've done observations, I think, in every one of the options that I gave there, and some others, and they've been hugely varied. And for me, it was where I spent the most time in planning for the placements. It was the thing that I think had the most it was the biggest difference, I suppose, as a practice educator. Obviously there were differences about how we provided supervision virtually and all of that, but the biggest difference was all about direct observations, really. And as I said to you earlier, one of the things that I do when I feel a bit not sure is I go back to, well, what's helped me in the past? And so I went back to the University of York's model of direct observation. It's called Facts, Feelings and Feedback, the model of direct observation. It's a collaborative model of direct observation, and it suggests this particular model of direct observation, which is from 2000. But they suggest that you need to think through the observation in 3 stages. So the 3-stage model that we've already talked about: before, during and after the observation. So reflecting the stages, I suppose. And that you need to think about the facts and the feelings and the feedback throughout all 3 stages. So in their planning stage, they suggest that you agree the role of the observer, which is largely about whether the observer is going to be participant or non-participant. Are they taking part or are they just watching? Think about what's the possibilities of intervention? When might the observer intervene if it becomes necessary? All of this must be discussed in the planning, they say. But the key thing that they say that is different and relates again to the number 3 is that they suggest that in the planning stages, both the practice educator and the student, or the observer and the worker, outline 3 objectives. So 3 things that they want. So the student will say to me, here are 3 things I want you to look out for during the observation. And I will say to the student, here are 3 things that I'm going to be looking out for. And that can actually be really helpful for students to know that this is specifically what's going to be being considered, because an observation is hugely nerve-wracking. And I think in some ways it's been more nerve-wracking during the pandemic. So outlining these objectives can be really helpful. And I've revisited this and gone back to this and done this much more, I think, in a much more structured way, perhaps, than I did before the pandemic, where the observations would maybe just happen, the planning wouldn't be as detailed. I've done a lot more detailed planning. But something I've added, which wasn't in the original University of York, was think about the practicalities of technology. How is it going to work? How will it work? What happens if, as in one observation where the student was going out to see the service user face to face, they took out their telephone and they videoed just themselves during the observation. Obviously consent was gained and everything, but the video was just on them. What happens when the video camera doesn't work, and how the students doing the whole thing feeling like this is being observed, but actually it didn't actually happen because the camera didn't work and the call didn't last. So they went through the whole of an observation feeling that they were being observed, and they weren't actually being observed. So how do you think about planning for practicalities and what might happen if? So practicalities matters. And then doing, these are some of the things that the model says you should think about in doing. Think about user consent. And I think one thing that's really important is to clarify with service users that they can withdraw consent at any point. So at any point the observation can end. Just because they say at the beginning it's okay for this to be observed, that doesn't have to continue. And I think we need to give more clarity about consent to service users in relation to direct observations. And that needs to be part of the planning. Who is going to give that clarity to service users about involvement in the observation? Because of course there's always at least 3 people involved in an observation. There's the practice educator, there's the student, and then there is the person being observed. Potentially more people can be involved. Thinking about the potential difficulties, I don't know if people have difficulties you want to share in the chat. Talk about how things have gone. Quite a few people may have come here not having done an observation yet, so you want to think about the potential difficulties. For me, in the past, the difficulties were always, how do I make sure I don't participate? Because you sit in a room and you're visiting out there with the student will sit down. That I find often the service user would look to me. So when they're giving answers, they'd look to me or they'd ask me things, and I'd be trying to think, I'm sitting here saying nothing, just try and ignore me. It's very difficult. You do get pulled in. Children come over and climb on you and talk to you, and it's very hard to do nothing in an observation. That was always my biggest issue in the past. That's been no problem this time, because I've just sat on my computer screen and I've had nobody's tried to look to me or come to me, or that's been easier. But currently the difficulties are very different. There are still difficulties. They're just very different difficulties. Now the difficulties lie with the tech. The other thing I've found has been hugely easier has been note taking. I don't know if other people have found this, and if we were in a room together, other people could share their experiences. I'm very conscious I'm only sharing one practice educator experience, mine, with 5 students. But what I found much easier this time is note taking. Normally I can feel a little bit self-conscious about taking notes during an observation, because I notice that the service user's looking at how much are you writing down, and they're probably thinking they're writing stuff about me when actually I'm writing about the student. And I always try and be very clear about that, but I still think it can be off-putting for the service user. But I've written loads of notes. I've found the note taking, because I'm not in the room, has been so much easier. So some things are easier. There are challenges, but there were challenges before. We've just got different kinds of challenges. And I would say there's a lot of positivity about doing observations differently. Did you want to say something, Zoe? You look like you want to say something.
There's loads coming in the chat. There's some people saying it can feel less obtrusive. There's a great comment here. You know, I turn off my camera and microphone so they forget I'm there, because I'm observing the PEs with students. Some people have mentioned things like poor visual quality, poor audio. Some people have said getting the service user feedback's a little bit harder because the person hasn't met them. Agreement around note taking being easier. They're just coming in. There was a situation where the camera was focused on the service user. Denise has put, we really need to stop using this word, and not the student, and they were wearing PPE. It muffled their communication over virtual, and it was quite unsatisfactory. So I think there's some positives and some negatives coming out. Things around internet connection, I think we can all appreciate that's a big one. And I think the last one I'll just mention is it's just come in, doing observations differently, but we're doing practice differently too. So we need to monitor participation and incorporate discussion around the issues that might come up beforehand. So that's just a bit of a summary of what's coming in the chat.
I agree. I do think that going back to that making sure that we use all 3 stages in the direct observation, going back to that planning and really talking through, and I think being very clear whether this is a newly qualified worker or a practice educator being observed, or, you know, whoever's being observed. I think we just need to be really clear that actually it might not be satisfactory because I can't hear you because of the PP. That doesn't mean it's a failed observation. It just means we need to do another observation. I think we need to be very clear in the planning that we might need to do more than one observation to make up something, or we might need to. The students that I've just been working with recently, normally I would expect to do 3 is the magic number. I would expect to do 3 direct observations during a placement. But I think because there were so many concerns about how can this placement continue, and it was all very adapted and the placement days were cut down, so were the number of observations, and I was only required to do 1 observation. Now, I think in future, I would be saying I still want to do more than one observation, and it's possible to do more than one observation. And I did actually, with most of the students, do more than one observation in various different ways, maybe not formally. But I do think we need to be clear, if we are being asked to do only one observation, it has to be a very, you know, we have to be certain, it has to be a good observation, it has to be substantial, it can't just be one quick telephone call. We need to think through what we're observing. So the planning is really important. And then the third stage of the University of York's model is the reviewing and the feedback. So we do a holistic assessment of the observed practice, the use of the knowledge and skills statement and the PCF, depending on which one we're focusing on. I would suggest it can be helpful to use a model of reflection to consider the evidence that's been generated. I'd also think, I mean, I've put a question mark there. My view is that it's best to give verbal feedback immediately after an observation, and then written feedback needs to be timely. The University of York suggests a detailed feedback session, a verbal detailed feedback session, where they say the feedback should end on the surprises, satisfactions, dissatisfactions, learning. And that's been taken, and a lot of people use that in lots of different ways now. I know I do, but that's where it originally comes from, is how to conclude the feedback session after a direct observation. So I would say, again, this is very different, because previously, in all my years of being a practice educator, I would generally get in a car with somebody, we'd set off, we'd go and drive to wherever we were going, we'd go to the house together, we'd drive home together, and I would give some immediate verbal feedback in the car on the way back to the student. I can't do that now, because very often I've done the observation and it ends, and then I've got no. So I tried to make sure that there was a way of an almost immediate contact back with the student afterwards to give them some verbal feedback straight away, and then a detailed feedback session later. So I think we need to think about how we do that. But that model, facts, feelings and feedback, is what the model is called, the model of direct observation. It's actually very similar to Greenway's active review model, which I would suggest is a really good model to review the evidence that you've got. So the facts, what actually happened in this observation? Feelings, how do you feel about that? Findings is your conclusion. What are your findings about that? And then futures, what needs to happen next? For me, the University of York model always reminds me of Greenway's active review model, which is actively used a lot in social work and social care. They're very similar. If you look at it, facts, feelings and feedback is the University of York's observation model. Greenway's facts, feelings, findings, futures. I would say let's combine the two. Let's go facts, feelings, findings, futures and feedback, because actually that's really helpful. When we give feedback to people, we need to think about findings and futures. So the final thing about direct observation that I'm going to say before Charlotte's going to tell us about her own experiences of being observed, both in the old-fashioned way and in the new way. We're going to look at the past, the present and the future with Charlotte. Just the final thing to mention is, I know everyone will know about this if you're a practice educator, but the Hawthorne effect. And I've just put a bit of an outline on the slide here about where this term comes from. But the Hawthorne effect is basically the understanding that being observed impacts on behaviour, that we don't behave in the same way when we're being observed as when we're not being observed. And I agree with what Zoe fed back from the chat about direct observations, that to me, the way in which we observe now feels less intrusive. However, we've still got to be aware that the Hawthorne effect is going on, even if it feels less intrusive. Even if you think, oh, they've forgotten I'm here, people have still not forgotten you there. So people will still behave in different ways because they're being observed. But I do think we need to think about the impact of new ways of working. How is that impacting the Hawthorne effect? The way in which people behave differently because they're being observed. Perhaps the way in which people behave differently because they're not surrounded by a team as well can also have an impact. So I think just thinking through the impact of new ways of working and going back to that old 1950, so 70-year-old research, but that is still referenced a lot when we think about doing direct observations. So I'm going to hand over now to Charlotte, who is going to bring her own perspective. So previously we've had students share with us at this point in the webinar, but this time Charlotte's going to share with us her perspective about observations, and then we're going to look at the other two areas of the of triangulation, and we're going to conclude with feedback. But Charlotte, it's over to you for a little while.
Thank you. So for those who may have joined after, so I'm Charlotte Pattinson. I am a qualified social worker doing my ASYE in an adult social care team. So I've obviously had the experience of having what you may call like a traditional placement, and also more remote assessment through my ASYE. So I just kind of wanted to, I suppose, compare my experiences of both of them really. Obviously we're in different times now where a lot of us are working from home or may not have the team around us, etc. So obviously things are a bit different than what they were when I was a student on placement. So first thing, as soon as I thought about direct observations, was obviously my feelings of direct observations. So that was something which I wanted to talk about initially, and how nervous I was, I suppose, like having a practice educator sitting in the room with me. That added to my nerves, I felt. But even though like I got a bit of confidence about them being there, I suppose, like how Siobhan was saying, that sometimes the individual who you're with does look at the practice educator for their kind of response as well, as rather than focusing on me. So I suppose if you look at it like as virtual, like with my virtual one, the person who I was like having the discussion with, they weren't that they were aware of who, like I had an assessor in the like I did a telephone call, so they were aware of that, but they couldn't see them. So that added like a bit more confidence to me, I suppose, because it made me feel like they're actually listening to me and not really thinking about, oh, what's that person saying, what's that person writing down. But I suppose like throughout, like when I've compared them in terms of like my nerves and stuff, like I was very nervous throughout like all of my direct observations, but because I didn't have that presence of the practice educators sitting in the room with me, I felt that made me feel a bit more calm about the situation. And like I suppose how you were saying about the effect, Joss, like I was very much like talking on the phone and stuff like that is something that comes natural to me because I've done these kind of roles, but a lot of people obviously are different, so I guess it would depend on who they are. But to me it was like a natural thing. It ended up being more, I suppose, like more of a conversation and more relaxed, and I suppose I got probably a bit more than what I would have done possibly if I had somebody sitting behind me or whatever. So I felt that was helpful for me in terms of that. But also like in terms of like the timescales, I know that we spoke about like it may be a bit shorter one, and because I was on the telephone, it was shorter than what I did with my face-to-face one, because I was more of a practical, like they were more practical. I was more engaged with the person, like if I was in a children's placement at that time, so I was engaged with a child. I was doing different activities, which at that time in my recent one, I was a bit kind of, I didn't have all that, so it was just kind of someone talking to me. So yeah, it didn't really feel like an assessment for me for my ASYE one, even though I knew I was being assessed, and I had the before and after kind of discussion about it, which was always really helpful, just to ground you, because you're like, oh no, what am I going to say, what am I going to do? But that really was really helpful, just because like having the technical difficulties that we all face. And I know I do apologise about my mic as well, because I do know there was an issue which we had to kind of sort out today. So I do apologise if you can't hear me very well. But it's like stuff like that, isn't it? Like I had a conference call which I've never done before, so I had to plan in, how do I do that? What is it that I need to do? How I did a trial one before, so it's just been like really, I think you've got to plan every opportunity, haven't you? Like if people have, I know like for myself, we don't have the opportunity to use anything like WhatsApp, so that's out of the question for us, but a lot of people do use it, and it's very natural for a lot of people, depending on who you work with, to use WhatsApp over the phone and do video calls that way. And I suppose we're becoming a bit more realistic in terms of like technology, and I think that's really positive for the profession, because there is stuff which you can do over internet or over that telephone, whereas like before it was pretty much we did a face to face, and that's how it was. And I suppose like when I think about the future, we're going to the practice is changing like a lot, isn't it? In terms of we're doing more stuff remotely. We may think, oh, this could be done over the internet, this could be done over the telephone, and adapting how we are working. So yeah, it was just my experiences were really positive, really. And I think when I think about like my future ones, I think Siobhan's thought of quite a lot of good input, to be fair, like the planning and maybe being a bit more creative in how we do the direct observations. I know that that's something which I'm thinking about doing. We use the Microsoft Teams and stuff like that, but there is ways and little apps and stuff that you can use which can be more engaging for people as well, which I think it's all about being, I suppose, as creative as possible as we can in the strange time that we're living. Obviously it's I suppose it'll benefit everybody in the future in terms of building on how we work as a profession, really. I don't know if there's anything else really that I need to add on, but yeah, I had a really good experience, and like I think adding in the technical stuff is really important to consider, just because things do happen and marks do drop out and internet does drop out, and how we, I suppose, build up on that. But I really like the idea of doing more than what's recommended in terms of observations during this time, because we can't guarantee how things are going to be. Like you could have a phone call and it lasts 10 seconds or 10 minutes. It's not really much to go off. So I think it's really important to kind of look at that, and that's something which I'll be considering as I've now got a new assessor for my ASYE. So it also adds to that, helps them to assess me properly. So yeah.
Thank you, Charlotte. You're on mute, Siobhan.
Oh, I muted myself to try and make sure that everyone could hear you as best as possible. So, but thank you, Charlotte. I think it's always really good to hear the perspective of the person being observed. So that was really helpful. Thank you. And I agree with you about the future. I think even when all of the pandemic has gone, for however it happens, we don't know what's going to happen, but I don't think we'll ever go back to the way things were anyway. And I think direct observations, because I've found there's been some real positives about doing direct observations differently, I would expect in the future not to have to do every observation face to face, to use the diversity of ways that we have for observations. So thank you for sharing with us. So just to go back to the three sources, we've looked only at direct observation. While Charlotte was talking there, I just got the opportunity to dip into the chat very quickly, and I saw some really good advice from Sarah about the Hawthorne effect, for example. So I would just say there's some really good hints in the chat from people who are very experienced sharing their thoughts. So we will make sure that we also send out the chat to you as well, which I think we've done previously, because there's such a lot of learning in the chat as well as on the slides. So you'll get the slides and the chat. So going back to the three sources of evidence very quickly, just to look at product evidence and feedback evidence, just to say really, essentially in social work, whether we like it or not, product evidence tends to be the paperwork that we complete. And of course, it's important to regularly review recording and documentation and how the social worker or the newly qualified worker uses the agency documentation and so on. I've got to say, again, I found working remotely easier doing this, because as an off-site practice educator, it's very, very easy for me, by doing supervision via Teams, for the student to screen share and show me something that they've been working on or that they're completing. So I found that's been helpful. I would just say it's important to remember, I know everybody knows this, but I can't move on from product evidence without just saying, remember the Data Protection Act. The only product evidence that should go into a student's portfolio is products of their thinking. They shouldn't be putting in, here's an example of a piece of work that I've done, because it's in breach of data protection. So just be very conscious of what is shared, what students are doing, I suppose, with product evidence. I would also just make sure that you're clear with students that they don't keep a copy of an assessment that they've done because, oh, that was a good assessment, I'll just keep a copy to refer back to. Just be very, very clear with students about product evidence and the Data Protection Act. And then the final of the 3 sources of evidence is feedback evidence. And of course, we know the student needs to gather feedback from a range of sources, from team colleagues and professionals. And the central importance of feedback from service users is now widely recognised. If we go back to the past, present and future, in the past when I qualified, it was actually written that it was unethical to try and get feedback from service users. And I can reference that for you in research and so on. So, you know, we've really moved as a profession our thinking around the importance of feedback from service users. Again, a phrase I don't like, but I don't know how else to describe it. And I agree with the chat that there are aspects of that have become more difficult, but equally I have had a couple of video conferences with service users afterwards, after an observation, to gather feedback. I've also just asked students to be much more creative about gathering service user feedback, and I've asked for more service user feedback because I've had less observations. So I think we've made quite a lot of progress, I feel, with students this time on gathering feedback. So they're the 3 sources of evidence. I don't want to spend any more time on those now because we don't have a huge length of time in these webinars, and there's so much to do. You know, the whole of assessment in an hour and a half is really challenging. So the thing that I really want to focus in on, aside of observations, is feedback. How do we give feedback? And there are a lot of 3s around feedback. There's 3 reasons for giving feedback, the literature says. There's 3 types of feedback, and there's 3 models for providing feedback that I'm going to run through with you. So the literature says that we have 3 reasons for giving feedback to people. So if we revisit previous webinars, look at the why. Why do we give feedback for people? The literature says 1 reason is to thank people, to say thank you, to keep them going. 1 is to coach people, and another is to evaluate practice. And that's from the literature, very clearly in leadership and management literature, very clear that there are 3 reasons that we give feedback. And there are 3 types of feedback, the literature says. There's constructive feedback, or there's destructive feedback, or there's missing feedback. So constructive feedback, it can be either positive or negative, but it's feedback that's given in a constructive way. Destructive feedback is feedback which isn't constructive. It focuses on faults and it's directed at the person, at the individual. I think very often in social work we have a missing feedback approach. No news is good news approach. It's almost like we don't really get a lot of feedback in social work. I don't think it's great, and I think that that has an impact on our ability to provide feedback. Much like when we talked in supervision and we said the research says that the biggest impact on how you provide supervision is the supervision you receive, that's very similar for feedback. There is a real art to giving feedback to professionals, and I think that art is sometimes misunderstood and misdeveloped, and I think it's a real key skill. And if I'm honest, it is always on my own professional development plan. I think it's the area that I need to develop the most, is how to give feedback, and how to give feedback about things that are not so good. So how to give negative feedback in a constructive way is always high on my own learning agenda. And I think it's because we don't give feedback very much. We're not good at giving feedback. So I've tried to put a few things together just to demonstrate what we mean by giving of feedback, and just to explore how should we give feedback, and then adding in that layer of remote feedback. So constructive feedback, I'm not going to go all the way through this. There's a grid there for you to take a look at, but you know, constructive feedback is feedback which concentrates on the person's behavior, on their performance, on their capability, whereas destructive feedback focuses on the person, the individual. Constructive feedback strengthens relationships and can in fact repair relationships, whereas destructive feedback damages relationships. So it's a two-way process to give constructive feedback. One of the problems is, as much as you work on how you give feedback, there's also that how does the person receive feedback, and unless someone is open to receiving feedback, it can be then very difficult to give constructive feedback. So I've also included towards the end of the webinar a grid that I would say, when you get the slides, it might be useful to share with the learner, with the student or the practice educator that you're assessing, whoever you're assessing, that's about how to take feedback, be open to feedback, and I'd suggest that's really important. But just some tips on providing feedback. Firstly, feedback needs to be facilitative. It needs to enable change. It needs to give options for people on facilitating their learning. It needs to be evidence-based. We need to be clear and provide the evidence of the feedback that we're giving. So be descriptive rather than evaluative. Describe what you saw when you give feedback. We need to be timely with feedback. So give the feedback as early as possible, as soon as possible after the issue has occurred. I know Joe Finch's work on working with struggling students, one of the things Joe says such a lot is we leave little things too long until they become big things. So we need to give feedback as early as possible and deal with difficulties as early as possible. We need to make sure that the feedback is developmental. It gives people options for development. It enables them to think about how they can improve the practice. It should be balanced. So we should talk about both the positives and the negatives. So we need to give balance in our feedback. We must make sure that the feedback that we give is accurate. Make sure that what we say is accurate. We've got it accurately. And we need to make sure it's clear. Does the person understand what we're saying? Sometimes, especially if we're giving feedback that we're challenged by, sometimes we dance around it a bit too much rather than just being clear, and then people aren't sure what was that about. But I also think that whatever the feedback, it's important to be kind. And at the moment, with the way emotions are and high levels of tension, then kindness is perhaps more important than anything. And you'll see that that spells out, that basic advice spells out the word feedback. Couple of methods of giving feedback that I just want to run through. The sandwich technique is perhaps the one that's the most well known in social work. Feed forward feedback is becoming very popular now in organisational development. And there's also SBI as a particular method of providing feedback that I found SBI particularly helpful when I've been thinking about how do I give feedback. So very quickly, those three models of feedback. First of all, feedback sandwich. What we know is we should start with a positive, then give the negative, and then end with a positive, so that we sandwich the negativity within positivity. That's been around such a long time now. I think sometimes people hear a positive and they're just listening for, okay, what's the negative? Because they're just so used to there's going to be something coming. And it's been so overused in social work, it's not always helpful, but it's still something to think about. So maybe even just the idea of, if you're going to give three things, give two positives and a negative and something that needs to be worked on. So there's your feedback sandwich, very traditional. Feed forward feedback. I don't know how much you've heard about this and whether you've explored this, those of you who are doing practice educator training, but it comes from Marshall Goldsmith, who wrote about it first. He's a big writer in terms of management strategies, and this is used a lot in big business. And the idea of feed forward feedback is, what they say is we shouldn't use feedback. We should, it's a bad word. Don't talk about feedback, talk about feed forward. So the idea is that Goldsmith claims that feedback is problematic for three reasons. Firstly, it shuts down our mental dashboards. That's what he says. It shuts down our mental dashboards. And I think it's that bit about, like the sandwich, you hear the positive, you're not listening to it, you're just waiting for what's the negative. So it's because of the stress that we hear, getting things, being told this didn't work very well, it shuts down our mental dashboards. He says it focuses primarily on ratings and not development. Now, I would argue with that, because I think largely in social work we do focus on development, but you know, this is his model, and he says that feedback focuses, rather than on development, it focuses on looking back and grading performance that's already happened, rather than looking at what should happen from now on. And he says it reinforces negative behaviours. So this is a direct quote taken from his website, actually, where he says, when we hear about flaws, then I can't actually read it myself because it's covered up a bit. So when we hear about flaws that we can't fix anymore because they're in the past, so we can't change the past, it creates a feeling of learned helplessness. It creates the feeling that we're unable to do anything about our future. We can't change it. So instead of committing ourselves to improvement, which is what we would hope would happen, Instead, we hold on to this debilitating view of who we are instead of focusing on who we are becoming. And I think that could be quite helpful, actually, to think about when we give feedback to students, try and help them to see, who are you becoming? What kind of social worker do you want to be? And feedback that focuses on who you're becoming rather than who you are is helpful. So he asserts that feed forward focuses entirely on the future, so it's transformative. Instead of talking to people about what they've done, you focus instead on what they want to improve. So the idea is, you would ask a student, for example, write down an area that you want to improve. Tell me an area that you want to improve of your practice, and then you talk to them about that. Or the student asks for 3 positive suggestions for the future in their feedback that they're gathering. So when they're gathering feedback from professionals, I'll say, can you give me 3 positive suggestions as to what I might do differently in the future? So that rather than focusing on what has been done, focusing on what needs to be done. And that's a way of looking at feed forward. Now, you could have a whole webinar on feed forward, and it'd be a really interesting one, because I do think it's something about the way in which we focus on what's been done rather than what needs to be done could be useful. But that's feed forward. The model that I find particularly helpful when I'm providing feedback is SBI, it's referred to as. It's really just about how you structure providing feedback. So you say, this is the situation, this is what I saw you do, and this was the impact of it. So this is the, the situation, gives them the environmental issues, this is what you did, and this is the impact of what you did, so that you can be much more descriptive rather than evaluative. And you can work on that further so that you do situation, behavior, impact, then offer, if you'd have behaved in this way, if you would have done this, I think it would have had this impact. So you're basically saying, what you did had this impact. If you'd have done it like this, I think it would have had a different impact. I think that can be quite helpful generally in giving a structure to feedback which is evidence-based and clear. And I think they're the 2 things that are really important in terms of feedback. So we still have a little bit of time, but not a huge amount of time to go through. I've prepared 3 slides about 3 responses. These are 3 common responses taken from the past, and then I'm going to put them into the present and the future. So what if a student or a newly qualified worker or whoever you're giving feedback to disagrees with the feedback? So my advice is, if they disagree with the feedback, go for SBI, because then you can focus on exactly what happened. The first thing to clarify is, does the person disagree with what happened, or are they just disagreeing with your feedback? Because if they disagree with actually what happened, that can be problematic. Although I have found that the fact that we can now have possibly a video of the observation can be helpful, although I don't keep it, so I make sure ethically the video is gone. But if you're trying to provide feedback and somebody says, no, that didn't happen, there is some video evidence potentially there for you to say, well, it did, so this is how it happened, look. But I think if someone's disagreeing with the feedback, making sure that you are evidence-based is really important. What about if they start crying? Because that's quite common. People will start crying during feedback. Now, what's interesting is, in my experience, people have cried more when I've given positive feedback than when I've given negative feedback. I don't know if that's a stress reliever or whatever, but sometimes people will cry when given feedback. So I've put a bit of advice there. So be empathic. I think particularly at the moment, perhaps you'll be shocked about if no one's mentioned that to you before. Give permission for the crying. We talked about tears last time in webinar 2 and how it can help. Try not to put off giving the feedback, because I think sometimes some responses to feedback can be used as a bit of an avoidance tactic. So, try to support the person but continue to give the feedback. And then the third option is someone can become angry. And it's quite a common response, I think, to being given feedback is a kind of fight or flight response. So sometimes people will get angry about the feedback that you're providing. So I've just tried to anticipate potentially some of the responses that you get to feedback. And I've also provided a table here, as I said earlier, which I'm not going to go into, but just to show people can take an open or a closed approach to feedback. And I find this can be quite helpful to share with people, to say, look, this is what demonstrates an open approach to feedback. And I feel perhaps at the moment you're taken a bit of a closed approach, what she thought about that, so that you can talk to the person about the feedback that they're getting from you, but also the feedback they're getting from others, feedback from service users, and so on. So that's a bit about feedback, and I know I've rushed through it, but I really wanted to talk about conversations in the remote world, I suppose, and just kind of looking through the 6 C's of conversations. So the Department of Health standards for social work supervision for adults, Department of Health and Social Care, adult social work supervision. In the standards, they refer to the need to have challenging conversations in supervision. In leadership, they talk about crucial conversations. We talk a lot in feedback about coaching conversations. Joe Finch talks a lot about courageous conversations, building on the work of Beddoe and Davis. We could also think about constructive conversations in terms of feedback. I think actually what we do in our conversations, they're very complex. We're doing a huge amount of stuff. When we're having conversations around assessment, they're complex because they bring in all of those things. The conversations we have are challenging, they're crucial, they're coaching, they're courageous, they're constructive, but they're also remote, and that's problematic. So they were the C words of conversations, but we're going to go to the other F word. We've talked about all these Fs. I said to you, there's, number 3 on the letter F, but there's an other F word. And that other F word is going to be a challenge as to how do we discuss this in a webinar that's being recorded. So we may take some of this webinar out of the recording because we want to talk about fail, the F word that nobody wants to hear. Charlotte is doing brilliantly. So I never like to discuss an F word in front of somebody. So Charlotte and Omar, there's no worries around this. Don't even think about this F word. But it's an important thing for us to think about. How do we deal with and how do we have conversations with students who are struggling about the F word when actually all of that is taking place virtually? And there's a real challenge to this, I think.
Do you have any experience of that, Siobhan, that you want to share?
So Zoe, we've talked about this, haven't we, and whether to share aspects. If we were together in a room, I might share things that it's not always appropriate, but we have checked out who is attending this webinar. And so what I'm going to share with you will be cut, but within this webinar, I think some people have had experiences of working with students who have failed during the pandemic. And I think it's important for us to think about how that might be, how it might feel. If you've ever worked with a student who is failing, you will know how emotionally challenging that is. It is so emotionally challenging. As a practice educator, you question yourself so much about what could I have done differently? What role did I play in this? And it's very challenging. I think it's even more challenging when it happens virtually. And I think there are some people in the audience who are here from universities, and universities might want to just talk about this a bit in the chat, not in terms of specific examples, because we're not going to use specific examples. We're going to talk about things that may occur. But it has been my experience, practice educators, if we think about the past, in the past, practice educators have talked a lot about how it can feel you're on your own when you're failing a student, that you can feel sometimes like you've got into a bit of a fight with a university. It doesn't feel like we're part of the same team around a student sometimes. And I don't know if people want to say if you agree or disagree with that in the chat, but I think failing a student can feel quite challenging, and it can end up feeling a bit us and them between university and between practice, and that can happen. I think it's really important that it doesn't feel us and them, and that we work together, and bring in academics and practitioners together at this moment in time is more important than it's ever been, I think. But equally, I know that universities, not just within social work, but universities across the board are saying we do not want students to be disadvantaged because of COVID. So a lot of universities have brought in a safety net so that there's no fail of assignments submitted during COVID, or that people get the opportunity to resubmit without the fail being granted, or so they're changing their usual failing procedures for all university programs. and that's also impacting on social work. So what do we do if we're working with a student who fails? And as a practice educator, we believe that fail would have happened whether the placement was virtual or in person or whatever. But the university believes, but that has been impacted by COVID, because placements have been impacted by COVID, and therefore we're not going to accept a fail of something that's been impacted by COVID. What kind of issues are we going to run into in this remote world? And this is all potentially theoretical, but also potentially based in experience. So I don't know if people are putting anything in the chat. If Zoe would like to, you know, maybe Zoe and I could have a conversation about this now. That's perhaps where.
I think essentially there are some questions that I think we might have to hang on and answer for some people at the end, just over the webinar as a whole. But some of the conversations coming out around failing students, as expected, is there. You know, Anna Jones has said, you know, I've worked with a student who's failed and never anticipated the emotional impact this had on me as a practice educator and the team. It can, sorry, I can't see full names now. It's all coming up short, but someone else has said it can feel so personal and very unprepared for the reaction. Someone who's an independent practice educator has said it depends very much on the university as to the support you get. A lot of people saying they felt on their own. Someone had a lot of support from the university, but found it really upsetting. That's Helen. I think that's Helen Stanley. Someone else has said the university that they were working with at the point was unhelpful. Someone else says, does a no-fail policy undermine the view of students who passed this year? Will the COVID generation be seen with scepticism, which I think is the point we discussed briefly before. We've had a couple of comments. I'm just trying to scroll back up, about using role play to further assess, to allow the challenging students to perhaps reflect on their behaviours or things that they're bringing up. Worked with a failing student during the pandemic and found it really difficult not having them in the same room. I think we're going back into other areas there, so let me scroll back down again.
That's an interesting point, Zoe, that I've not kind of thought of. I think probably largely because I'm an off-site practice educator, so whenever I've worked with failing students, I've never had to sit in the same room as them all the time, and I know it must be so hard as an on-site practice educator to be working through that very difficult process with a student and still be sitting in the same room as them. And I've never had to experience that, and I can only sort of empathize with how that must feel. But I've not thought about the fact that actually maybe has that made it more difficult for me? I would have thought, well, I would not want to be sitting alongside of somebody when I'm failing them. But I do think this doing it virtually has been so much more difficult. And also it is always isolating, as people have said, working with a failing student, but it's more isolating when you're doing it virtually and you're doing it remotely and you don't have a team around you to bounce those thoughts off. And so I do think there are some real issues here for us that, and I think that question about a no-fail policy, how is that going to impact on people in the future? All these things are really important issues. And I almost feel like, you know, we've tried to look at assessment, the past, the present and the future to some extent today, but you almost need a separate session to look at what are the issues of when we're working with failing students. But very, very challenging, I think, very challenging. Did you have some others there as well, Zoe, did you say?
Yeah, so there's been a few comments around the sandwich. You know, some people will just hear the negative and they'll be so focused on that they won't hear the positives. Charlotte's been working in a school, with a social work student in a school. One of the teachers, who's the on-site supervisor, uses 2 stars and a wish. So she gives 2 things that are going well, and she asks the student, to give 2 things that are going well and 1 wish of what they'd change. We've had a couple. It's very hard to scroll down here. Using both methods, using lots of methods together to reflect and plan on future learning. There's times when reflecting on something you did with a view to understanding why is useful feedback. So critique of the feed forward from that perspective. Someone in the Q&A has asked who developed the SBI model. So I don't know whether you can...
I can't reference the SBI model, if I'm honest, because it's so widely utilised. It's a bit like the positive sandwich technique. Everybody knows about positive sandwich, so it's so widely used, I wouldn't be able to reference it. So if people were wanting to reference it for a practice educator qualification or something, if you Google SBI, it's all over the place, and then you'll find, you know, it'll take you to some reading around it. But it's huge in management circles, has been for many years, SBI.
And I think the only other question in the Q&A, Siobhan, is I think in the table you had around destructive and constructive feedback, someone said, how does destructive feedback reduce stress? I don't know whether that's been...
Oh, did I mistype?
I don't know whether it's been put in the wrong column or whether it is a point.
Oh yes, no, it should say raises stress and tension. I'm very sorry. There's a
that's okay. That answers that. And there's a lot more comments coming in. A few people are having to leave, but I will just read out a few of the last ones just so we can make sure, because I think especially the failing bits been quite common. So students not in the office, so we're not getting feedback from colleagues about their concerns, so it removes another source of evidence. Some of the ways we interact in real life would show the pressure points easier. Someone said SBI seems similar to the BIF model. Yeah, so there's loads in there. Like I say, I've asked Omar to send the chat and the slides alongside certificates, so people will hopefully see all of this.
Because it sounds like it's a lot of rich learning.
Yeah. There's a great variety of people here today as well. There's people at the beginning of practice educator training, ASYE assessors, PE assessors, universities. So yeah, it'll be really good conversation to see.
Useful, lovely. Well, in the first webinar, we used share to look at the top row is the students' share, and the bottom row of this grid is the assessors' share. So we looked at the top row in the first webinar in terms of what's the students' learning environment and what do they share in the learning environment. So what do they see, hear, do, read, and how do they evaluate it? And I said that the first bit of writing is the past. So I always used to think about, you know, what will the student read, what will the student do, what will the student hear? And then in italics underneath, I've just put some comments about working virtually, working remotely. The bottom grid, we've added just for today, just to summarise everything, to kind of bring all of the webinars together. So what does the practice educator see of the student's practice is all about direct observations. And we've talked today about the variety of virtual or remote opportunities and how it can work better than person. In hearing, I do think we do need to think about who we want feedback from, and we do need to seek it more early. As you said from the chat, Zoe, not having colleagues sitting around the student means that maybe issues aren't raised as soon as they might be, or that you don't have that additional evidence. It's very much feels much more reliant on you as the practice educator now, than you're not able to draw on feedback from others. You'll definitely need to do things differently. In terms of reading, I've definitely asked the students I work with to do more reflective writing, and they've been happy to do that, but as a kind of additional evidence base. And I've also found accessing recording more straightforward with screen sharing, as I've said. And then in terms of evaluation, I think everything is so new, everything is just a very different way of working, and everything's changed overnight that we just have to keep constantly evaluating. I still feel that there is a great joy in being a practice educator, even in remote working. And in terms of just finishing off looking at assessment, what I would say to you is we've looked at past, present and future of assessment, and it is really, really important to be very clear in final reports about students' future learning needs, or about the future learning needs of a newly qualified worker or whatever. I've always said this is important, but more now than ever before, as a practice educator, when a student is ending placement, be very clear about what opportunities has this student had during this placement, and what opportunities have they not yet had? What do they need to take into their final placement, or what do they need to take into their first year in practice that they've not been able to do or not been able to have because of the pandemic? Be detailed and be specific, but also generic. What I see sometimes in future learning needs is it'll say something like, they need to be in a children's safeguarding team. Well, that's not a future learning need. That's the way you'd like them to go. You know, keep these general so they can be met anywhere, but specific enough to say this is what this person needs to do. You need to put together future learning needs that are measurable and achievable, but are very clear. So that's a kind of final call, is that future learning needs are vital. And the references for everything that I've put in are included on the slides.